Unit 16. Chemistry in Everyday Life. From Living Perception to Abstract Thought and From This to Practice by V.I. Lenin. By now you have learned the basic principles of chemistry and also realized that it influences every sphere of human life. The principles of chemistry have been used for the benefit of mankind. Think of cleanliness. The materials like soaps, detergents, household bleaches, toothpaste, etc. will come to your mind. Look towards the beautiful clothes. Immediately chemicals of the synthetic fibers used for making clothes and chemicals giving colors to them will come to your mind. Food materials, again a number of chemicals about which you have learned in the previous unit will appear in your mind. Of course, sickness and diseases remind us of medicines, again chemicals. Explosives, fuel, rocket propellants, building and electronic materials, etc. are all chemicals. Chemistry has influenced our life so much that we do not even realize that we come across chemicals at every moment. That we ourselves are beautiful chemical creations and all our activities are controlled by chemicals. In this unit, we shall learn the application of chemistry in three important and interesting areas, namely medicine, food materials, and cleansing agents. 16.1 Drugs and their classification. Drugs are chemicals of low molecular masses. These interact with macromolecular targets and produce a biological response. When the biological response is therapeutic and useful, these chemicals are called medicines and are used in diagnosis, prevention, and treatment of diseases. Most of the drugs used as medicines are potential poisons if taken in doses higher than those recommended. Use of chemicals for therapeutic effect is called chemotherapy. 16.1.1 Classification of drugs. Drugs can be classified mainly on criteria outlined as follows. A. On the basis of pharmacological effect. This classification is based on pharmacological effect of the drugs. It is useful for doctors because it provides them the whole range of drugs available for the treatment of a particular type of problem. For example, analgesics have pain-killing effect, antiseptics kill or arrest the growth of microorganisms. B. On the basis of drug action. It is based on the action of a drug on a particular biochemical process. For example, all antihistamines inhibit the action of the compound histamine, which causes inflammation in the body. There are various ways in which action of histamines can be blocked. You will learn about this in section 16.3.2. C. On the basis of chemical structure. It is based on the chemical structure of the drug. Drugs classified in this way share common structural features and often have a similar pharmacological activity. For example, sulfonamides have common structural feature given below. And structure you have to see from your book. D. On the basis of molecular targets. Drugs usually interact with biomolecules such as carbohydrates, lipids, proteins, and nucleic acids. These are called target molecules or drug targets. Drugs possessing some common structural features may have the same mechanism of action on targets. The classification based on molecular targets is the most useful classification for medicinal chemists. 16.2 Drug target interaction. Macromolecules of biological origin perform various functions in the body. For example, proteins which perform the role of biological catalyst in the body are called enzymes. Those which are crucial to communication system in the body are called receptors. Carrier proteins carry polar molecules across the cell membrane. Nucleic acids have coded genetic information for the cell. Lipids and carbohydrates are structural parts of the cell membrane. We shall explain the drug-target interaction with the examples of enzymes and receptors. 16.2.1 Enzymes as drug targets. A. Catalytic action of enzymes. For understanding the interaction between a drug and an enzyme, it is important to know how do enzymes catalyze the reaction in their catalytic activity. Enzymes perform two major functions. Number one, the first function of an enzyme is to hold the substrate for a chemical reaction. Active sites of enzymes hold the substrate molecule in a suitable position so that it can be attacked by the reagent effectively. Substrates bind to the active site of the enzyme through a variety of interactions such as ionic bonding, hydrogen bonding, van der Waals interaction, or dipole-dipole interaction. Number 2. The second function of an enzyme is to provide functional groups that will attack the substrate and carry out chemical reactions. B. Drug-enzyme interaction. Drugs inhibit any of the above-mentioned activities of enzymes. These can block the binding site of the enzyme and prevent the binding of substrate, or can inhibit the catalytic activity of the enzyme. Such drugs are called enzyme inhibitors. Drugs inhibit the attachment of substrate on active site of enzymes in two different ways. Number 1. Drugs compete with the natural substrate for their attachment on the active sites of enzyme. Such drugs are called competitive inhibitors. Number 2. Some drugs do not bind to the enzyme's active site. These bind to a different site of enzyme which is called allosteric site. This binding of inhibitor at allosteric site changes the shape of the active site in such a way that substrate cannot recognize it. If the bond formed between an enzyme and an inhibitor is a strong covalent bond and cannot be broken easily, then the enzyme is blocked permanently. The body then degrades the enzyme inhibitor complex and synthesizes the new enzyme. 16.2.2 Receptors as drug targets. Receptors are proteins that are crucial to body's communication process. Majority of these are embedded in cell membranes. Receptor proteins are embedded in the cell membrane in such a way that their small part possessing active site projects out of the surface of the membrane and opens on the outside region of the cell membrane. In the body, message between two neurons and that between two neurons to muscles is communicate through certain chemicals. These chemicals, known as chemical messengers, are received at the binding sites of receptor proteins. To accommodate a messenger, shape of the receptor site changes. This brings about the transfer of message into the cell. Thus, chemical messengers give message to the cell without entering the cell. There are a large number of different receptors in the body that interact with different chemical messengers. These receptors show selectivity for one chemical messenger over the other because their binding sites have different shape, structure, and amino acid composition. Drugs that bind to the receptor site and inhibit its natural function are called antagonists. These are useful when blocking of message is required. There are other types of drugs that mimic the natural messenger by switching on the receptor. These are called agonists. These are useful when there is lack of natural chemical messenger. 16.3 Therapeutic action of different classes of drugs. In this section, we shall discuss the therapeutic action of a few important drugs. 16.3.1 Antacids. Overproduction of acid in the stomach causes irritation and pain. In severe cases, ulcers are developed in the stomach. Until 1970, only treatment for acidity was administration of antacids, such as sodium hydrogen carbonate or a mixture of aluminum and magnesium hydroxide. However, excessive hydrogen carbonate can make the stomach alkaline and trigger the production of even more acid. Metal hydroxides are better alternatives because of being insoluble. These do not increase the pH above neutrality. These treatments control only symptoms and not the cause. Therefore, with these metal salts, the patients cannot be treated easily. In advanced stages, ulcers become life-threatening and its only treatment is removal of the affected part of the stomach. A major breakthrough in the treatment of hyperacidity came through the discovery according to which a chemical histamine stimulates the secretion of pepsin and hydrochloric acid in the stomach. The drug cimetidine tegamet was designed to prevent the interaction of histamine with the receptor present in the stomach wall. This resulted in release of lesser amount of acid. The importance of the drug was so much that it remained the largest selling drug in the world until another drug, ranitidine, that is Zantac, was discovered. 16.3.2 Antihistamines. Histamine is a potent vasodilator. It has various functions. It contracts the smooth muscles in the bronchi and gut and relaxes other muscles, such as those in the walls of fine blood vessels. Histamine is also responsible for the nasal congestion associated with the common cold and allergic response to pollen. Synthetic drugs, brompheniramine, that is dimetap, and terfenadine, that is sildane, act as antihistamines. They interfere with the natural action of histamine by competing with histamine for binding sites of receptor where histamine exerts its effect. Now the question that arises is, why do above mentioned antihistamines not affect the secretion of acid in the stomach? The reason is that anti-allergic and antacid drugs work on different receptors. 16.3.3 Neurologically active drugs. A. Tranquilizers. Tranquilizers and analgesics are neurologically active drugs. These affect the message transfer mechanism from nerve to receptor. Tranquilizers are a class of chemical compounds used for the treatment of stress and mild or even severe mental diseases. These relieve anxiety, stress, irritability, or excitement by inducing a sense of well-being. They form an essential component of sleeping pills. There are various types of tranquilizers. They function by different mechanisms. For example, noradrenaline is one of the neurotransmitters that plays a role in mood changes. If the level of noradrenaline is low for some reason, then the signal sending activity becomes low and the person suffers from depression. In such situations, antidepressant drugs are required. These drugs inhibit the enzymes which catalyze the degradation of noradrenaline. If the enzyme is inhibited, this important neurotransmitter is slowly metabolized and can activate its receptor for longer periods of time, thus counteracting the effect of depression. Iproniazid and phenelazine are two such drugs. Some tranquilizers, namely chlorodiazepoxide and meprobamate, are relatively mild tranquilizers suitable for relieving tension. Equanil is used in controlling depression and hypertension. Derivatives of barbituric acid, that is veronal, amityl, nambutyl, luminal, and seconal, constitute an important class of tranquilizers. These derivatives are called barbiturates. Barbiturates are hypotonic, that is sleep-producing agents. Some other substances used as tranquilizers are Valium and serotonin. B. Analgesics. Analgesics reduce or abolish pain without causing impairment of consciousness, mental confusion, incoordination or paralysis, or some other disturbance of nervous system. These are classified as follows. Number 1, non-narcotic, that is non-addictive analgesics. Number 2, narcotic drugs. Number 1, non-narcotic, that is non-addictive analgesics. Aspirin and paracetamol belong to the class of non-narcotic analgesics. Aspirin is the most familiar example. Aspirin inhibits the synthesis of chemicals known as prostaglandins, which stimulate inflammation in the tissue and cause pain. These drugs are effective in relieving skeletal pain such as that due to arthritis. These drugs have many other effects such as reducing fever, that is antipyretic, and preventing platelet coagulation. Because of its anti-blood clotting action, aspirin finds use in prevention of heart attacks. Number 2, narcotic analgesics. Morphine and many of its homologs, when administered in medicinal doses, relieve pain and produce sleep. In poisonous doses, these produce stupor, coma, convulsions, and ultimately death. Morphine narcotics are sometimes referred to as opiates, since they are obtained from the opium poppy. These analgesics are chiefly used for the relief of postoperative pain, cardiac pain, pains of terminal cancer, and in childbirth. 16.3.4 Antimicrobials. Diseases in human beings and animals may be caused by a variety of microorganisms such as bacteria, virus, fungi, and other pathogens. An antimicrobial tends to destroy or prevent development or inhibit the pathogenic action of microbes such as bacteria, that is antibacterial drugs, fungi, antifungal agents, virus, antiviral agents, or other parasites, that is antiparasitic drugs selectively. Antibiotics, antiseptics, and disinfectants are antimicrobial drugs. A. Antibiotics. Antibiotics are used as drugs to treat infections because of their low toxicity for humans and animals. Initially, antibiotics were classified as chemical substances produced by microorganisms, that is bacteria, fungi, and molds, that inhibit the growth or even destroy microorganisms. The development of synthetic methods has helped in synthesizing some of the compounds that were originally discovered as products of microorganisms. Also, some purely synthetic compounds have antibacterial activity, and therefore, definition of antibiotic has been modified. An antibiotic now refers to a substance produced wholly or partially by chemical synthesis, which in low concentrations inhibits the growth or destroys microorganisms by intervening in their metabolic process. The search for chemicals that would adversely affect invading bacteria but not the host began in the 19th century. Paul Ehrlich, a German bacteriologist, conceived this idea. He investigated arsenic-based structures in order to produce less toxic substances for the treatment of syphilis. He developed the medicine arsphenamide known as salvarsan. Paul Ehrlich got Nobel Prize for Medicine in 1908 for this discovery. It was the first effective treatment discovered for syphilis. Although salvarsan is toxic to human beings, its effect on the bacteria, the spirochete, which causes syphilis, is much greater than on human beings. At the same time, Ehrlich was working on azodise also. He noted that there is similarity in structures of salvarsan and azodise. The Az linkage present in arsphenamide resembles the nitrogen double bond nitrogen linkage present in azodise in the sense that arsenic atom is present in place of nitrogen. He also noted tissues getting colored by dyes selectively. Therefore, Ehrlich began to search for the compounds which resemble in structure to azodise and selectively bind to bacteria. In 1932, he succeeded in preparing the first effective antibacterial agent, that is prontosil, which resembles in structure to the compound salvarsan. Soon it was discovered that in the body, prontosil is converted to a compound called sulfanilamide, which is the real active compound. Thus, the sulfa drugs were discovered. A large range of sulfonamide analogues was synthesized. One of the most effective is sulfapyridine. Despite the success of sulfonamides, the real revolution in antibacterial therapy began with the discovery of Alexander Fleming in 1929 of the antibacterial properties of Penicillium fungus. Isolation and purification of active compound to accumulate sufficient material for clinical trials took 13 years. Antibiotics have either cidal, that is killing, effect or a static, that is inhibitory effect on microbes. A few examples of the two types of antibiotics are as follows: bactericidal, penicillin, aminoglycosides, ofloxacin, and bacteriostatic, that is erythromycin, tetracycline, and chloramphenicol. The range of bacteria in other microorganisms that are affected by a certain antibiotics is expressed as its spectrum of action. Antibiotics which kill or inhibit a wide range of gram-positive and gram-negative bacteria are said to be broad-spectrum antibiotics. Those effective mainly against gram-positive or gram-negative bacteria are narrow-spectrum antibiotics. If effective against a single organism or disease, they are referred to as limited-spectrum antibiotics. Penicillin G has a narrow spectrum. Ampicillin and amoxicillin are synthetic modifications of penicillins. These have a broad spectrum. It is absolutely essential to test the patients for sensitivity, that is allergy to penicillin, before it is administered. In India, penicillin is manufactured at the Hindustan Antibiotic in Pimpri and in private sector industry. Chloramphenicol, isolated in 1947, is a broad-spectrum antibiotic. It is rapidly absorbed from the gastrointestinal tract and hence can be given orally in case of typhoid, dysentery, acute fever, certain form of urinary infections, meningitis, and pneumonia. Vancomycin and ofloxacin are the other important broad-spectrum antibiotics. The antibiotic dicydazarine is supposed to be toxic towards certain strains of cancer cells. B. Antiseptics and disinfectants. Antiseptics and disinfectants are also the chemicals which either kill or prevent the growth of microorganisms. Antiseptics are applied to the living tissues such as wounds, cuts, ulcers, and diseased skin surfaces. Examples are furosemide, soframycin, etc. These are not ingested like antibiotics. Commonly used antiseptic Dettol is a mixture of chloroxylenol and terpineol. Bithenol, the compound is also called bithionol, is added to soaps to impart antiseptic properties. Iodine is a powerful antiseptic. Its 2-3% solution in alcohol water mixture is known as tincture of iodine. It is applied on wounds, and iodoform is also used as an antiseptic for wounds. Boric acid in dilute aqueous solution is weak antiseptic for eyes. Disinfectants are applied to inanimate objects such as floors, drainage system, instruments, etc. Same substances can act as an antiseptic as well as disinfectant by varying the concentration. For example, 0.2% solution of phenol is an antiseptic while its 1% solution is disinfectant. Chlorine in the concentration of 0.2 to 0.4 ppm in aqueous solution and sulfur dioxide in very low concentration are disinfectants. 16.3.5 Anti-fertility drugs. Antibiotic revolution has provided long and healthy life to people. The life expectancy has almost doubled. The increased population has caused many social problems in terms of food resources, environmental issues, employment, etc. To control these problems, population is required to be controlled. This has led to the concept of family planning. Anti-fertility drugs are used in this direction. Birth control pills essentially contain a mixture of synthetic estrogen and progesterone derivatives. Both of these compounds are hormones. It is known that progesterone suppresses ovulation. Synthetic progesterone derivatives are more potent than progesterone. Norethindrone is an example of synthetic progesterone derivative most widely used as anti-fertility drug. The estrogen derivative which is used in combination with progesterone derivative is ethynylsteroidal, that is novestrol. 16.4 Chemicals in food. Chemicals are added to food for number 1 their preservation, number 2 enhancing their appeal, and number 3 additive nutritive value in them. Main categories of food additives are as follows, like food colors, flavors and sweeteners, fat emulsifiers and stabilizing agents, 4th flavor improvers, anti-stelling agents and bleaches, antioxidants, preservatives, nutritional supplements such as minerals, vitamins and amino acids. Except for chemicals of category, none of the above additives have nutritive value. These are added either to increase the shelf life of stored food or for cosmetic purposes. In this section, we will discuss only sweeteners and food preservatives. 16.4.1 Artificial sweetening agents. Natural sweeteners, example sucrose, add to calorie intake and therefore many people prefer to use artificial sweeteners. Orthosulfobenzimide, also called saccharin, is the first popular artificial sweetening agent. It has been used as sweetening agent ever since it was discovered in 1879. It is about 550 times as sweet as cane sugar. It is excreted from the body in urine unchanged. It appears to be entirely inert and harmless when taken. Its use is of great value to diabetic persons and people who need to control intake of calories. Some other commonly marketed artificial sweeteners are given in table 16.1, and they are aspartame, saccharin, sucralose and aspartame. Aspartame is the most successful and widely used artificial sweetener. It is roughly 100 times as sweet as cane sugar. It is methyl ester of dipeptide formed from aspartic acid and phenylalanine. Use of aspartame is limited to cold foods and soft drinks because it is unstable at cooking temperature. Aspartame is a high potency sweetener, although it is more stable than aspartame. The control of sweetness of food is difficult while using it. Sucralose is trichloro derivative of sucrose. Its appearance and taste are like sugar. It is stable at cooking temperature and it does not provide calories. 16.4.2 Food preservatives. Food preservatives present spoilage of food due to microbial growth. The most commonly used preservatives include table salt, sugar, vegetable oils, and sodium benzoate, C6H5COONA. Sodium benzoate is used in limited quantities and is metabolized in the body. Salts of sorbic acid and propanoic acid are also used as preservatives. 16.4.3 Antioxidants in foods. These are important and necessary food additives. These help in food preservation by retarding the action of oxygen on food. These are more reactive towards oxygen than the food material which they are protecting. The two most familiar antioxidants are butylated hydroxytoluene, that is BHT, and butylated hydroxyanisole, that is BHA. The addition of BHA to butter increases its shelf life from months to years. Sometimes BHT and BHA along with citric acid are added to produce more effect. Sulfur dioxide and sulfite are useful antioxidants for wine and beer, sugar syrups, and cut, peeled or dried fruits and vegetables. 16.5 Cleansing agent. In this section, we will learn about detergents. Two types of detergents are used as cleansing agents. These are soaps and synthetic detergents. These improve cleansing properties of water. These help in removal of fats which bind other materials to the fabric or skin. 16.5.1 Soaps. There is a reaction, and that is glyceryl ester of stearic acid combines with 3NaOH, that is sodium hydroxide, and then it forms sodium stearate, that is 3C17H35COONA plus glycerol or glycerine, you can say. Soaps are the detergents used since long. Soaps used for cleaning purpose or sodium or potassium salts of long chain fatty acids. Example: stearic, oleic and palmitic acids. Soaps containing sodium salts are formed by heating fat, that is glyceryl ester of fatty acid, with aqueous sodium hydroxide solution. This reaction is known as saponification. In this reaction, esters of fatty acids are hydrolyzed and the soap obtained remains in colloidal form. It is precipitated from the solution by adding sodium chloride. The solution left after removing the soap contains glycerol, which can be recovered by fractional distillation. Only sodium and potassium soaps are soluble in water and are used for cleaning purposes. Generally, potassium soaps are soft to the skin than sodium soaps. These can be prepared by using potassium hydroxide solution in place of sodium hydroxide. Types of soaps. Basically, all soaps are made by boiling fats or oils with suitable soluble hydroxide. Variations are made by using different raw materials. Toilet soaps are prepared by using better grades of fats and oils, and care is taken to remove excess alkali. Color and perfumes are added to make these more attractive. Soaps that float in water are made by beating tiny air bubbles before their hardening. Transparent soaps are made by dissolving the soap in ethanol and then evaporating the excess solvent. In medicated soaps, substances of medicinal value are added. In some soaps, deodorants are added. Shaving soaps contain glycerol to prevent rapid drying. A gum called rosin is added while making them. It forms sodium rosinate which lathers well. Laundry soaps contain fillers like sodium rosinate, sodium silicate, borax and sodium carbonate. Soap chips are made by running a thin sheet of melted soap onto a cool cylindrical and scraping off the soaps in small broken pieces. Soap granules are dried miniature soap bubbles. Soap powders and scoring soaps contain some soap as scoring agent, that is abrasive, such as powdered pumice or finely divided sand, and builders like sodium carbonate and trisodium phosphate. Builders make the soap acts more rapidly. The cleansing action of soap has been discussed in Unit 5. Why do soaps not work in hard water? Hard water contains calcium and magnesium ions. These ions form insoluble calcium and magnesium soaps respectively. When sodium or potassium soaps are dissolved in hard water, the reaction is 2C17H35COONA, that is soap, plus CaCl2 gives out 2NaCl plus C17H35COO to the whole twice Ca, that is insoluble calcium stearate, that is soap. These insoluble soaps separate as scum in water and are useless as cleansing agent. In fact, these are hindrance to good washing. Because the precipitate adheres on to the fiber of the cloth is gummy mass. Hair washed with hard water looks dull because of this sticky precipitate. Dye does not absorb evenly on cloth washed with soap using hard water because of this gummy mass. 16.5.2 Synthetic detergents. Synthetic detergents are cleansing agents which have all the properties of soaps but which actually do not contain any soap. These can be used both in soft and hard water as they give foam even in hard water. Some of the detergents give foam even in ice-cold water. Synthetic detergents are mainly classified into three categories. Number 1, anionic detergents. Number 2, cationic detergents. And number 3 is non-ionic detergents. Number 1, anionic detergents. Anionic detergents are sodium salts of sulfonated long-chain alcohols or hydrocarbons. Alkyl hydrogen sulfates formed by treating long-chain alcohols with concentrated sulfuric acid are neutralized with alkali to form anionic detergents. Similarly, alkyl benzene sulfonates are obtained by neutralizing alkyl benzene sulfonic acids with alkali. Now the reaction is CH3CH2 CH2OH, that is lauryl alcohol, in the presence of H2SO4 forms lauryl hydrogen sulfate, that is CH3CH2 CH2OSO3H. Then in the presence of NaOH aqueous, it forms CH3CH2 CH2OSO3 negative and Na positive, and this is sodium lauryl sulfate, that is anionic detergent. Now the next reaction is CH3CH2 benzene, that is dodecyl benzene, and it forms in the presence of H2SO4 CH3CH2 benzene SO3H, and this is dodecyl benzene sulfonic acid. In the presence of again NaOH aqueous forms CH3CH2 benzene SO3 negative and Na positive, and the name is sodium dodecyl benzene sulfonate. In anionic detergents, the anionic part of the molecule is involved in the cleansing action. Sodium salts of alkyl benzene sulfonates are an important class of anionic detergents. They are mostly used for household work. Anionic detergents are also used in toothpaste. Number 2. Cationic detergents. Cationic detergents are quaternary ammonium salts of amines with acetates, chlorides or bromides as anions. Cationic parts possesses a long hydrocarbon chain and a positive charge on nitrogen atom. Hence, these are called cationic detergents. Catyl trimethyl ammonium bromide is a popular cationic detergent and is used in hair conditioner. Cationic detergents have germicidal properties and are expensive. Therefore, these are of limited use. Number 3, non-ionic detergents. Non-ionic detergents do not contain any ion in their constitution. On such detergent is formed when stearic acid reacts with polyethylene glycol, and the reaction is CH3CH2 COOH plus HOCH2CH2O to the whole N CH2CH2OH, and its name is polyethylene glycol, and it forms CH3CH2 COO CH2CH2O whole N CH2CH2OH, and one water molecule is removed in this reaction. Liquid dishwashing detergents are non-ionic type. Mechanism of cleansing action of this type of detergent is the same as that of soaps. These also remove grease and oil by micelle formation. Main problem that appears in the use of detergent is that if their hydrocarbon chain is highly branched, then bacteria cannot degrade this easily. Slow degradation of detergents leads to their accumulation. Effluents containing such detergents reach the rivers, ponds, etc. These persist in water even after sewage treatment and cause foaming in rivers, ponds and streams, and their water gets polluted. These days, the branching of the hydrocarbon chain is controlled and kept to the minimum. Unbranched chain can be biodegraded more easily and hence pollution is prevented. Summary. Chemistry is essentially the study of materials and the development of new materials for the betterment of humanity. A drug is a chemical agent which affects human metabolism and provides cure from ailment. If taken in doses higher than recommended, these may have poisonous effect. Use of chemicals for therapeutic effect is called chemotherapy. Drugs usually interact with biological macromolecules such as carbohydrates, proteins, lipids, and nucleic acids. These are called target molecules. Drugs are designed to interact with specific targets so that these have the least chance of affecting other targets. This minimizes the side effects and localizes the action of the drug. Drug chemistry centers around arresting microbes, destroying microbes, preventing the body from various infectious diseases, releasing mental stress, etc. Thus, drugs like analgesics, antibiotics, antiseptics, disinfectants, antacids, and tranquilizers are used for a specific purpose. To check the population explosion, anti-fertility drugs have also become prominent in our life. Food additives such as preservatives, sweetening agents, flavors, antioxidants, edible colors, and nutritional supplements are added to the food to make it attractive, palatable, and add nutritive value. Preservatives are added to the food to prevent spoilage due to microbial growth. Artificial sweeteners are used by those who need to check the calorie intake or are diabetic and want to avoid taking sucrose. These days, detergents are much in vogue and get preference over soaps because they work even in hard water. Synthetic detergents are classified into three main categories, namely anionic, cationic, and non-ionic, and each category has its specific uses. Detergents with straight chain of hydrocarbons are preferred over branched chain as the latter are non-biodegradable and consequently cause environmental pollution. Chapter completed. See you soon in the next chapter. Thank you so much.